Health insurance before Medicare. Now, this is new to me. I could not believe I had a guy, I think in South Carolina, who posted this on one of my on the comments on one of the videos I did, and I said I never thought about it. It's fantastic. I think. So anyway, he enrolled in his local community college, and he got on their student health insurance plan, the SHIP student health insurance plan. I said, really? So anyway, check this out. I was doing some research last night, and I just came across United Healthcare college student health insurance. Taking new steps as part of growing up. When you're a college student, the steps may seem to get bigger by the minute. One of the steps is choosing a health insurance plan. Now, I'm just going to forewarn you. Uh, uh, Colleges are, we all know they're corrupt as can be. All right, we know. They got fees for this, they got fees for that, they get health fee. Health fee isn't the premiums for health insurance. Health fee is if you if you go see the local person on campus, that's your health fee. All right. So this is on top of that. On top of that, the schools are there's a lot of controversy. The schools basically upselling you this crap because they say, well, we can get a fee for it and we're going to pocket the money. Look, college is reverse Robin Hood, man. It's robbing from the poor to give to the rich. No other way around that. So don't have any qualm then about taking advantage of an opportunity if it presents itself to you, because at the end of the day, we're paying for all this anyway. So let's check this out. I just like how they say college students, like getting bigger, you're growing up. Well, check it out. What is a student exactly? Experience lower costs and added benefits, says United Healthcare. No, this is the company that provides you, so they're not going to undersell their stuff. But lower costs, deductibles, and premiums, comprehensive benefits, including added services not always found in other plans. Greater access to national local healthcare networks of physicians and behavioral health specialists. Better coverage for school-sponsored on-site clinics. So I was reading, like in California, Kaiser Permanente is huge in California, but it's not huge in other states. And so if you're at the Stanford Cardinal Health Insurance Plan, for instance, and you're from New York and you're going back to New York over Christmas or something like that, this is an example they used. There isn't really any Kaiser Permanente plans there or network. So inherently it can be out of network. Inherently it's going to be problematic in some regards. So just keep that in mind. So you just got to look into it. But that's up to you to look into this. However, that was California. So I want to show you something. We're going to go down to choose a plan, and we're going to go here, find a plan. All right. And what we're going to do is we're going to go to Georgia State University. So for instance, start with your school's name. So we'll just do Georgia. Yeah, Georgia College, Georgia State, Georgia Gwinnett, Georgia Southern, University of Georgia, University of North Georgia. I think there's even Georgia Tech in here. And so let's go to, I think that's Georgia Tech was in here. Yeah, Georgia Institute of Technology. Let's go to George Mason. See if George Mason. Oh, okay, no George Mason. Let's go to Virginia. See what's coming up in Virginia. So Virginia's VCU right there. Where else are we going to go to? Michigan. Eastern Michigan University. Let's go to Maine. All right, nothing in Maine. South Carolina. Nothing. Let's go to Florida. Yeah, Florida Atlantic, Florida Gulf, Florida State, University of Central Florida, University of North Florida, blah, blah, blah. All right, so let's go back to Georgia. We're going to go to Georgia State right here, because Georgia State's in Atlanta, but they're pretty big, and they have campuses throughout the state. And also on top of that, too, is that you can be online. All right, so we're going to read this. We already read that. So what we're going to do is we're going to go to voluntary. So the hard waiver is, I looked it up. I said, what is domestic hard waiver? That means basically you're covered for plans under someplace else. I don't know. I'm still confused. So if any of y'all know, let us know. But we're going to go to voluntary. My understanding is voluntary is you're voluntary going for the medical, or if you have a hard waiver, you have medical someplace else. But I'm confused by that, man. We're going to hit explore policy. And it's pretty interesting, actually. So we're at Georgia State, and we're going to go to summary brochure. Telehealth medical, student assistance, additional services, summary documents. We're going to go to summary of benefits and coverage. Let's try this first. And we're going to hit view. All right, so we're gonna hit view, and right here, look at this. It's PPO. So it's student family. See, it's not just for the student. It's student family. It's a PPO, Georgia State University. Uh, what's the overall deductible? 1,250 per family. Out of network, 1,450 per family. I was like, wow, that's pretty good. And anyway, so you can read all this. I was like, oh, that's pretty fantastic. And then we looked at my doc. We have our PP, our primary care physician was in there. Our allergist was in there, and I think that's all we looked at for the time being. But I was like, well, that's pretty cool. Um, I don't know what the premiums are, frankly. I just don't know. But all right, so then we say, okay, that was pretty good. So then we say, well, I want to enroll in Georgia State University, and I want to enroll. We're just going to go to Georgia State University here, and we're going to go to right there, and I'm going to enroll online. And I don't know if online covers. Actually, let me just say, I'm going to pause real quick. So I emailed them. I haven't received it back yet. It's just last night. I wasn't expecting to, but I want to know if online. So let me just show you. So here you got a mom with her kid. All right. So that is the family plan. There's no way that my wife was saying, was it only for me? Because I was saying maybe you should go online and get your and get a degree in accounting because she liked accounting actually, and she's good at it. She's good with clients and stuff. So I said, whatever, because she's the one mostly worried about health insurance. I said, just go online. Take 6 credit hours. I don't know exactly how it works. That's for you to determine. But I'm just sitting there thinking, okay, so we're gonna go to academics, and we're gonna go to let's see here, a degree. Let's just go associate degree pathways. You see what I'm saying? This is Georgia State. I think they have a. Let's go to accounting. Chemistry pathway, perimeter college right there. All right, computer science, dental hygiene, engineering pathway. I guess I don't have an accountant pathway. That's weird. Biology, maybe it's business. So locations, Alpharetta. You know what I'm saying? I mean, if you want to do that. But anyway, at the point being is, just real quick. English, general studies, geology. That's kind of cool. Health sciences, health sciences, health sciences, health sciences, history, journalism, kinesiology. I think it's sports, mathematics. All kinds of stuff. I'm saying for accounting path, but that's just That's just the associate's degree. So let's go back to after this. So let's go to online learning. Here we go. This is what I'm talking about. But yeah, I did online for perimeter. Right. College of examination, immunization. All right. Tuition 95 per credit hour. Explore pathways. All right. Exploring about tuition, financial aid. School. Did I just do that? Study campus. So where's this? Anyway, I don't know what the oh, here we go. Oh, it's through a perimeter college. Okay, cool. So you choose their classes, choose their catalog for. But I mean, you enroll in a couple classes, you got health insurance. I mean, that's not a bad gig. Again, I don't know how it works for you specifically, but I know for a fact that Georgia and Florida, in some states for VCU, you online. And so let's just say you live in freaking South Dakota. You're like, I'm going to enroll in Georgia Perimeter College's online campus so I can get their health insurance. Why not look into that? It's crazy not to. Or maybe you got let's take some. Well, I don't know how it works like University of South Dakota. Let's try something here real quick. We're just going to do South Service. Oh boy, that's not a good look. We're going to go to let's do I don't know University of Michigan student health student health. I saw it right there. Student health plan. Let's see what they offer here. University of Michigan. We're just going to do University of Michigan because Michigan been big on Michigan the last couple of days. Right here, health insurance plans for students. Domestic student health insurance plan available to UM students enrolled in classes. All right, and their dependents right there. If you need health insurance, please consider this plan, which is developed with students' needs in mind. And it says, see how Blue Cross is responding to COVID. So it's Blue Cross right here. To enroll online, Blue Cross N, I don't know what N stands for, University of Michigan Student Health Plan. Who can enroll? Let's take a look. Students, undocumented students. It's crazy how undocumented get better benefits than legal citizens. That's a legal immigrant. Undocumented is a legal immigrant, just FYI. Who enrolled in classes. Okay, degree-seeking students who are taking the class online. Students who are taking series are not eligible. So students who are taking online courses, MOOCs, which are not diploma eligible, are not eligible. So you have to be a degree-seeking student. Graduate and doctoral students are eligible. International students, green card holders, spouses, domestic partners of any gender, because there's 55 genders apparently, and children up to age 26 are eligible too. So right there, who are taking classes online or remotely are eligible. But you have to be taking a certain level of classes. Coverage cost, periods, and payment. Let's take a look. Effective dates. Cost for student plus two more, $5,500. I mean, cost for student and two more dependents. $5,500, man, or $5,600. And the out of pocket, I mean, I don't know what the deductibles and all that stuff are. I don't know, but at the end of the day, there you go. Is this a PPO? I have no idea, but this is through Blue Cross Blue Shield. Let's see the benefits. Prescription drugs, clinic, mental health. All right, because you all need mental health nowadays. Who can buy this plan? Low price voluntary plan associated with Blue Cross Network of Michigan. The annual purchase price is $2,000 to provide coverage throughout the U.S. So it's got to be a PPO, I imagine. Sponsored by the University of Michigan. Coverage periods, is it like a short-term plan? I don't know if it's like one of those short-term plans. I'm sure it's not underwritten, i.e., anyone can. What's the word I'm looking for? The pre-existing conditions. They're going to cover that. How to find a doctor outside of Michigan. Let's do this right here. Anyway, that's something for you to look at, man. Blue Cross Network. You and your dependents can rely on getting coverage anywhere in the U.S. Physician hospitals contract with Blue Cross nationwide participant Blue Card outside the state of Michigan. Click on the link. All right. Set this guy right here. So let's say I'm enrolled online at University of Michigan. What's the big one that's always Liberty University? Oh, Penn State. They're a big online one too. All right. Let's choose location. We're going to put 3004, which is my zip. Milton, Georgia. Yep. The three letters beginning at the. Okay, so I don't know my three letters, so I don't have that. But anyway, that's what you would do. Okay. I don't know how to get out of that. All right, let's go back. Anyway, so you get the gist. So Liberty University, they're big online. Penn State is big online. What's that? Southern New Hampshire, because they're advertised. Oh no, the one with the owl. Let's go to Southern New Hampshire. SNH. Southern New Hampshire University. Let's see if they have health insurance, because they're big online. They advertise down here. And there's one with an owl too. Student health. I bet they don't. I bet these guys don't, because it's all online. Anyway, so you have to look that up yourself. Student health insurance. If automatically wrote, okay, all right, let's check it out. This is GallagherStudent.com. I don't know what this is. Student health insurance plan. They do have one. All right, cool. I imagine it's through Blue Cross. All are required to have health insurance. If you don't have coverage, you will be automatically enrolled in the plan through the university and will be billed annually through this charge. If you have private health insurance, you must complete the waiver form. Okay. Insurance benefits. It's compliant with the Affordable Care Act. It means they don't underwrite you, i.e., there's no pre-existing conditions. Does it say who it's with? Covers preventive care, blah, blah, blah. Student per student right here, 1,500 smackers per child. So, I mean, I got 6 to 4 kids, so it's going to be expensive there. But it's basically $1,500 per person. I don't know what the out-of-pocket, here we go. International. I don't know what the out-of-pocket cost. Again, you have to look into that. But that's fantastic. And it's just an idea, man. You see what I'm saying? Now, look, if you can qualify for Obamacare, that might be cheaper. But that's another idea that you might want to look into. Love to hear your thoughts. If any of you guys are doing this or know about this, share them in the notes. Thanks now.